Hello, this is Dr. Steve Hotze. Have you had a tubal ligation and you find yourself experiencing hot flashes, night sweats, chills? Do you have a problem with fatigue, difficulty with weight, brain fog, inability to focus and think, memory loss, mood swings, change in your menstrual cycles, either getting heavier or they're getting lighter? Are you having problems with hair loss? Are you having problems with decline in your romantic moods and inclinations? If you are, then you have tubal ligation syndrome. As a matter of fact, it's known as post-tubal ligation syndrome, after a tubal ligation. Now, what's a tubal ligation? It's commonly known in just among the public as having your tubes tied in the general public. And what that means is that you've gone through a surgical procedure where they've made an incision normally above or below your umbilicus or your belly button, and they insert a laparoscope, and through that laparoscope they go to the fallopian tubes, which are the tubes that connect the ovaries to the uterus. And those tubes are clipped, they're tied, or they're cauterized, and that prevents the egg from, when it's released from the ovaries, from traveling down and entering into the uterus, where of course if you were going to become pregnant, a sperm would inseminate the egg and then you would have a conceptus, you'd have a new baby developing. Well, about 1/4 of all women undergo tubal ligation, and of those 25% of the women that have tubal ligation, about 40% have the post-tubal ligation syndrome. So what causes that? Well, it's caused by a decline in the blood supply to the ovaries. Whenever you tie off the ovaries, you are also tying off an ovarian artery that helps supply the uterine artery that goes to the ovaries. You have two arteries that go to the ovary, ovarian artery and uterine artery, and it ties off one of those arteries and it decreases the blood supply to the ovaries. And that oftentimes causes the ovaries to have a decline in their hormonal production, and usually within 2 years in women that have post-tubal ligation syndrome, effectively the ovaries quit functioning. And so you go through menopause or perimenopause and menopause at a much earlier stage in your life. Oftentimes this will lead to a situation called estrogen dominance, where the progesterone levels, and that's the hormone, that's the hormone of the last half of the menstrual cycle. In a menstrual cycle, in a 28-day cycle, from day one, first day of your period, after you stop making all your hormones, you begin to make estrogen hormones, you ovulate, and that's on day 14 or 15, and at that time you would make progesterone to balance out the estrogen. Well, what happens is when you get the blood supply cut to the ovaries, or as you age anyway, this happens to women without tubal ligation, the ovaries begin to produce lower levels of progesterone, and estrogen becomes the dominant hormone, which can lead to heavier menstrual periods. So maybe when you were younger they were 3 to 5 days now in light, now they're 5 to 7 days in moderate, or 7 to 9 days and you got clotting and maybe you get breakthrough bleeding. That's a sign of estrogen dominance. So if you're experiencing post-tubal ligation syndrome, it can be easily treated. Easily treated. Not with birth control pills, no. It can be treated with natural bioidentical hormones. So depending upon the symptoms that you're experiencing, if you're having night sweats, if you're having hot flashes, then obviously your estrogen hormones are declining. So you could take some natural estrogen. We use a natural bioidentical estrogen product here at the Hotze Health and Wellness Center. And we also balance that with natural bioidentical progesterone. So you take progesterone and you take Bias, which is a combination of two natural bioidentical estrogen products. You take those and that helps balance out your hormones. So whereas you've had a decline in your hormones causing these symptoms, now we simply replenish and balance those hormones so you feel normal again. Oftentimes when women have tubal ligation syndrome or post-tubal ligation syndrome, they develop fatigue, and that's because they have estrogen dominance. That's when the progesterone levels fall much lower and they don't balance the estrogen. That adversely affects your cell's ability to utilize thyroid hormones, which govern your body's metabolism. And you need to go back and look at my previous Facebook Live on the common undiagnosed illness of hypothyroidism. So the hormones tend to work together in synergy. So when your hormones are out of balance, female hormones are out of balance, that can adversely affect your body's ability to properly utilize the thyroid hormones, which govern your body's metabolism, the energy production in your cells. So again, post-tubal ligation syndrome occurs after a woman has had a tubal ligation, after she's had her tubes tied. Most conventional doctors say, oh, that doesn't exist. Well, let me just tell you what, ladies, for those of you that had a tubal ligation and all of a sudden you're starting to have all these hormonal symptoms of mood swings, fluid retention, weight gain, kind of like premenopausal symptoms, except they're lasting all month long and they're lasting all the time. You're getting loss of energy, difficulty with weight, inability to focus, your memory's gone. Short-term, long-term memory just aren't good. You have the mood swings, you have change in your periods, joint muscle aches and pains, loss of romantic moods and inclinations, hair falling out, and you just are sick and tired. That's caused by the decline of your hormones due to a decline in the blood flow to the ovaries that occurs after a tubal ligation. And that can be easily taken care of, and that's what we do here at the Hotze Health and Wellness Center. We replenish and balance your hormones with natural bioidentical hormones. So that's the story on tubal ligation and post-tubal ligation syndrome. I hope this provides you with some encouragement that you can get over this. Don't wait, my goodness. Don't wait for this to go on for years. I see people that have come in 10 and 15 years after they've had this and say, oh, my problems started with my tubal ligation. If you're having problems after a tubal ligation, the time to get treated is immediately when you begin to have your hormonal symptoms that I've described, and we can get you taken care of. So this is Dr. Hotze, and I wish you every success in obtaining and maintaining health and wellness naturally, because I believe that you need a doctor that can coach you on a path of health and wellness so that as you mature, you've got energy, you got vitality, and you have enthusiasm for life. Thank you for joining me.